and welcome to today's podcast about cancer awareness. Today we have with us Dr. Vikas Choudhary, Head of the Radiation Oncology Department, who will shed some light on cancer awareness and help the youngsters and older people and the upcoming generation how to battle cancer and prevent it in their lifestyle. Welcome, sir.
Thanks for the brief introduction. So, before head of the Department of Radiation Oncology, I am a general practitioner who is specialized in oncology. So, we will start the question.
Thank you so much, sir. Moving forward, today we are going to burst some myths and we will talk about some beautiful facts which will definitely enlighten your day. To start with, sir, what is the biggest myth about cancer that people still believe today in year 2025?
So, in my this practice of 15 years, I have find the biopsy every patient asks, sir, biopsy करेंगे तो कैंसर फेल जाएगा, तो is it possible कि without biopsy we can move further for the treatment? So the biggest myth is about the biopsy. Biopsy does not spread the cancer.
So I am very sure that when you see patients in your OPD, they are very hesitant कि हाँ हमें biopsy करवानी है नहीं करवानी है. So you say that that's a myth, that's a clear myth.
Yeah. So about the diagnosis, we initially will clinically examine the patient, and the first and foremost step is only about the biopsy. So हर patient की biopsy के बाद ही हम further move करते हैं for the imaging or for anything else. Once the biopsy is done and we are sure we are dealing with what kind of the cancer or malignant or benign.
So, can imaging tests replace biopsies in cancer diagnosis or moving forward?
So, this very common question even by the patients also कि सर बिना biopsy के ही आप imaging कर लीजिए, PET scan है आज के दिन, आप PET से पता लगा सकते हो कि कैंसर है या नहीं है, and biopsy रहने दीजिए. So, thing is that कि बिना biopsy के हम आगे नहीं बढ़ सकते और biopsy को इमेजिंग रिप्लेस नहीं कर सकती है, क्योंकि बायोप्सी मतलब हिस्टोपैथोलॉजी, जिससे हमें पता लगता है कि कौन सा टाइप का ट्यूमर है और किस तरह से हमें पर्सनलाइज्ड ट्रीटमेंट करना है उस चीज का. बिकॉज इवन फॉर एग्जांपल इफ इट इज अबाउट द ब्रेस्ट, सो वी नो इट इज अ ब्रेस्ट कैंसर इवन आफ्टर हैविंग अ पैट और मेमोग्राम आल्सो. बट थिंग इज दैट अगर बायोप्सी नहीं हुई है तो हमें उसके बारे में, उसका नेचर के बारे में नहीं पता लगेगा कि वो ट्रिपल नेगेटिव है या हार्मोन पॉजिटिव है या ओनली HER2 पॉजिटिव है, बिकॉज टोटल लाइन ऑफ ट्रीटमेंट डिपेंड्स ऑन द बायोप्सी एंड द नेचर ऑफ द डिजीज.
तो सर एक अर्ली डिटेक्शन की अगर हम बात करते हैं वो कितना जरूरी है, हाउ इम्पोर्टेंट इज अर्ली डिटेक्शन और क्या कॉमन मिसकंसेप्शंस है लोगों के अबाउट कैंसर स्क्रीनिंग, इवैल्यूएशन और हेल्थ चेक्स?
So early detection is very important for the treatment point of view and outcome point of view. अगर early detect हो गया stage 1 और stage 2 में, तो it's very easy to treat also. It's economically also very economically friendly, because the stage 1 and stage 2 have limited modalities to treat. There is no need many times only with surgery we can treat the patient. अभी कुछ ही दिन पहले very early breast cancer आता है, it was like we had done the surgery and there was not required of any radiation or chemo. Now she is on hormonal, and because it was very early, so she is fortunate enough कि only one modality is towards the curing the for the same cancer. So early detection is very important because the outcomes are very good. Like for say if it is stage 1, the outcome is around almost 90 to 95% cure rate, and for stage 2 it is like around 70 to 80%. As the stage increase, the cure rate decrease. अब रही स्क्रीनिंग की बात, तो सबसे बड़ा मिसकंसेप्शन ये है कि जी हमारे घर में तो किसी को था ही नहीं कैंसर, तो हम क्यों स्क्रीनिंग कराएं, तो ये गलत है, ये मिथ है. The reality is that if a female is above 45, they should go for a mammogram at least 3 years regularly. If after 3 years there is nothing, then they can wait for 2 or 3 years. And the same thing is with sexually active females. They should go for a pap smear. Like we are celebrating, just we celebrated this cervical month, January month. So it's very important. So screening is for mainly for high risk patients and high risk population, and it is important for those who are advancing in the age.
That clearly says that early detection is very, very important. So
Yeah, plus screening is also very important. But screening to put in a large extent, large population like in India, it is not that easy, especially अगर हम सी लंग की बात करें तो it's very difficult for every patient to go for a CT scan and other things. But हम उसमें से एक high risk population को हम find out कर सकते हैं, at least उनको screening के लिए हम push कर सकते हैं.
So moving forward, हमने ये भी देखा है कि अगर किसी को पता चलता है they are exposed to this that they have been diagnosed with cancer and they term it as a death sentence. So is it really true? Does it really matter? And with this current
so in this era, it is not at all like that. It's ये आप उस era की बात कर रहे हो जब एक बार राजेश खन्ना साहब की मूवी आई थी आनंद है, बोला कि जी कैंसर है तो जाना है, तो उस समय वो एक डर रहता था कि भाई कैंसर हो गया तो इसको जाना है. आज के दिन ऐसा नहीं. आज के दिन not about the stage 1 or stage 2, even the stage 4 मेटास्टेटिक स्टेज 4 ट्यूमर्स भी काफी सर्वाइव करते हैं 4 year, 5 year, 8 year, 9 years.
And as we have seen, some treatment wise, diagnostic wise, cancer treatment and diagnosis has advanced over the time. So what are the new advancements that
we see? So the biggest change in last 20 years first is about the PET scan. That is a very good modality which we should use in our daily practice. Though in urban setup it is very easy, but when the patient is in 2-tier or 3-tier cities, there PET is little difficult, but we should use that one because that help us to decide about the intent of the treatment. And then the advancement, if we see in the chemo part, so chemo is now much more refined, and chemo port is one of the things which make the things easy when we have to give chemo for more than 3 months or 5 months or multiple line of chemos or in a regimen where more than 2 drugs are there. So chemo port is a very good, it's a complete bless for the patients. Same thing, robotics, like the surgery wise, robotics is the best for the patient. So पहले open करके बड़ी सर्जरियाँ होती थी, time लगता था बहुत ज़्यादा, and now the very time is consigned and in minimum time, maximum recovery, minimum scar. So these advances are there. The same thing in radiation also, in my radiation. Like if we see, earlier we used to do treat the patients on cobalt. Now we have modern Linux. So modern Linux may be, it's like we say the Apple 14, 15, 16. So same upgrade every 5 to 10 years में upgrade आता है. और उसी हिसाब से रेडिएशन भी इतना मॉडर्न हो गया कि we can't think of like earlier those patients are completely blackening of the skin or so much reactions कि बीच में उनको ट्रीटमेंट हो गया या पेशेंट डिफॉल्ट हो रहा है ट्रीटमेंट से, वो आज के दिन नहीं है. प्लस द एडवांसमेंट ऑफ हाइपोफ्रैक्शनेशन, द एडवांसमेंट इन SRS, SBRT, there are so much to say कि it's completely we are moving from one era to the second era to the third era. It's like now the future will be MR Linux and protons. So there is lots of advancement in every vertical about either it's about medical, like other than chemo, immunotherapy. It's a bless for the patients. Targeted therapies, hormonal therapies, same for the surgery, robotics and other things, and the same for the radiation.
That's interesting to know, sir, that we have so many interesting advancements when it comes to diagnosis and treatment. As we talk about cancer, stress and emotional turnaround is something which is very closely related. So, क्या आपको लगता है कि stress and emotions is also directly related to cancer and can be?
See, they are as per evidence, they are not directly related to any cancer, but if your life is stress-free and emotionally, if you are strong enough, then you are in a good position always. If someday if someone detected with any type of cancer, if they are good, they are they don't have any stress kind of habit, or emotionally they are not low, then they will able to cope up with the situation much better than that. So it's all about the meditation. We should do it at least twice in a day for at least 5 minutes. It's very important because we can go through reels today. Nowadays we can just roll on our phone for the reels. Instead of that, we should incline towards the meditation. That's very important. That will definitely reduce your stress level. That will reduce your emotionally. They will make you more stronger. At the same time, other than meditation, your breathing exercise is very important. Both the things.
That's amazing. As we spoke a lot about recent advances and myths, most important thing that we do in a day is having food. So I would like to ask you, are there certain foods which really causes cancer, or it's just a myth?
So initially when we started our onco studies, so at that time initial our chapters all are about etiology of the cancer. In that we very well read also, and even in day-to-day practice also we have observed कि obesity की वजह से ना, obesity is linked to many cancers. So obesity comes that indirectly, directly or indirectly, it comes from the diet. So diet directly not related to your cancers, but it induces obesity. Then obesity is one of the cause. Few diets, like if we say red meat, they are more for the GI tumors. So somewhere they play a very important role. So we should balance the diets. We should have more of proteins and less of carbs and moderate kind of fats in our diet, so that we can control our weight and we not invite any of the cancer to our system. That's very important.
And as sugar consumption is seen to be as one of the myths, does it increases cancer growth?
No, it's again a big myth. Sugar खाने से कैंसर हो जाता है, ऐसा कुछ नहीं है. Sugar will just increase your blood in the blood, and it is again indirectly induce your obesity and nothing else. So sugar, moderate sugar is required for our better our cells, but if it is go beyond some consumption, whatever should be there, then definitely it will going to add some extra weight, and then it will induce obesity, and obesity will again invite for one or other type of disease, heart disease or diabetes or cancer, anything. The more the comorbidities are there, the more the chances of having cancer is there.
आजकल जैसे ऑर्गेनिक फूड्स का era है सर, तो क्या ऑर्गेनिक फूड्स बेटर रहते हैं फॉर कैंसर प्रिवेंशन, और हाउ इज इट कोरिलेटेड?
No, organic food is okay. We should have organic food. That's a good thing if it is everything under your supervision. So that's not possible. Those who are in city life, it's not possible for them. So organic food is not as such going to prevent or cure any kind of cancer. It's just a marketing things. Okay, we should go for organic. And there are other things also there, so it's okay. There is no evidence as such for that.
And does any kind of diet plays a role when it comes to recovery of a patient, somebody who is going through chemo or radiation?
Yeah, definitely. Diet play a very big role. Those जैसे हमारे पास head and neck cancers आते हैं, तो they go for radiation, definitely radiation for 7 weeks, and for post-op radiation for 6 weeks. The diet plays, at least for the 6 months, it's very stringent diet, mainly high protein diet, and we have to see which side we are going to treat. Accordingly, we'll advise them the diet. I myself act as a dietitian before going for the treatment. I optimize the patient. मेरे को बताना पड़ता है patient को आपको ये diet लेनी है, नहीं लेनी है. And those who want extra help, then I attach them to my onco-dietitian, so that they can able to have that much needed requirement of calories. It's very important. Diet is important. It's the journey of the treatment. It's very important. And even after completion of the treatment, it's very important because many patients lose weight and many patients not able to walk and their performance status go down, and their chances of coming to hospital for admissions increase if they don't have the proper diet. So diet plays big role, because during the treatment I advise my patient, please don't admit in hospital because of your low intake food. Diet is very important. Diet is like medicine, you have to have, because if you have a proper diet, then only you will able to complete a proper treatment. Otherwise it's very difficult.
Moving forward, let's talk a little bit about naturopathy, sir. Can naturopathy be effective when it is complemented with the conventional?
You are just hitting right chord. Right now, naturopathy is coming up after big celebrities are advocating about the naturopathy. Naturopathy is really good for prevention of cancer, or it is good post-treatment. But during the treatment, naturopathy have not a big role as such. The main pillars of the treatment is surgical, medical, and radiation. Other things under oncology umbrella are different. So it will going to become one of the umbrella of oncology umbrella. Like other things are there, psycho-oncology or oncodietitian, like that. It will definitely going to play a big role. But as such, it is not a main pillar of the treatment. So please think in that way. It helps in the prevention. It is good for post treatment, but during the treatment, keep focus on the standard treatment.
So what could be the risk? Because we have seen that there are people who would rely solely on naturopathy. What could be the risk if they do only naturopathy and
so in radiation, especially about talking about the radiation oncology, like after the surgery, patient come for on indication come for the radiation, but then patient, after we explain the patient, 6 weeks of radiation will be there in head and neck especially, or if any breast is there, for see breast, it's 15 days or of the radiation will be there. So they feel why to go for the radiation now? Disease where now surgery is done, even chemo is also done. So why to go for that? Let's move for the naturopathy. So thing is that treatment component they should understand in the initial start of the treatment. Once the cancer is diagnosed, they should know what will be the from A to Z of the treatment. From the day one, they should have in their mind these all components. We have to one by one we have to go through from one pillar to the other pillar. That's because cancer is not treated by one specialist. It is treated by 2 or 3 specialists. One specialist is just a bless for the patient if we treat some, like earlier I said initially, or if it's very early, then we can treat it by one specialist, but maximum around 70% of patients need all the 3 specialists. So that is very important. So naturopathy don't play a role in that part. We can't replace any of the treatment modality with naturopathy. Naturopathy is really good after completion of treatment.
And we talk about early stage detection, so in that stage also naturopathy.
Again, I just repeat my words. If it is very early, then sometime if patient is really lucky, then just be treated by one specialist. Otherwise, 2 or 3 specialists required. No, naturopathy can't replace any of the standard.
So as we spoke about organic foods, now is the era of alkaline water also.
Yeah, that is again new thing which I am listening from my many patients. They are asking me, sir, alkaline water वाला वो हम लगा लेंगे. It's very costly, but अगर it is really good, then sir क्या वो लगाने से कुछ फायदा होगा? कुछ साल हमारे वो बढ़ जाएंगे. So it is again no, complete no. Alkaline water is not going to help in any direction about the treatment of the cancer. So we have to try to change our natural, whatever the resources are there. We should not rely on that. Instead of that, try to be balanced in everything. Everything means your exercise, your diet, your other habits. Everything should be in a balanced way. If you go everything in a balanced way, then you are not inviting any of the disease. I'm not talking about right now about the cancer. I'm talking about any of the disease. Any of the means cardiac, diabetic, hypertension, or anything will not be invited by you. If it is come of their own, not because of you, then it's okay. Doctors are there to treat you. Try to attach with a good GP. Try to attach with good physicians or doctor related to the disease, whatever you diagnosed.
As we spoke about a lot of myths that are around, a lot of diagnostics that are around, talking in the direction of treatment and recovery, does chemotherapy do more harm than does good, as some people claim?
No, it's not like that. Chemotherapy, like for everything, some side effects are there. Even if I say कि पैरासीटामोल के कुछ साइड इफेक्ट, तो इवन पैरासीटामोल को भी एक डोज के बाद लेंगे तो उसका साइड इफेक्ट होगा ही. It's same thing for everything. The same thing for the chemo also. If dose is defined, if a certified medical oncologist is giving the chemo, then you are in a very safe end. But if you go to a quack or you go to a MD medicine, so he have just 1 year or 2 years of experience in chemotherapy, then definitely there may be a chance, because if they give some extra dose without knowing the side effects, much side effects of the chemo, then they may land up in some other side effects of the cardiac or some other effects, and in the long term they may land up even in the blood cancer. But if a certified medical oncologist induce or they give the chemo, then they know the very well. And now in India we have a good number of medical oncologists where you can go and get the proper chemo. No need to approach towards any of like radiation oncologist or surgical oncologist or any other practicing doctors. I'm advocating that one. Please approach a certified doctor for certified treatment.
And sir, can lifestyle changes, because people would want to go more towards prevention and cure and treatment, so can lifestyle changes really prevent or maybe cure cancer? What is your
Definitely I already used the word to balance everything. To lifestyle, we have to balance the things. We have to balance about our weight. We have to always check how much, like if we check our weight properly from time to time, then definitely we are on a safer side. And the lifestyle also, exercise, your diet, your other habits, about if you are a smoker, if you are alcohol, you take alcohol during your social gathering. So everything matters.
Sir, as we are nearing to the end of this conversation, and the theme of year 2025 is United by Unique, I would like you to shed some light on that.
So yeah, from 2025 to 2027, we are on the theme United by Unique. United means कि it's about the active participation of all practicing clinicians, either it is from general practitioner from the community or the oncologists who are doing the treatment day and night, or the supporting staff, or the everyone. What we are doing right now, it is all about that. That word united means we are all united together to prevent the cancer first, and to, if it is there, then to cure the cancer and to create the right kind of awareness in the society. If society is aware, society have good education about the disease, they know how to approach the things, then everything is fine. But if society don't know, if they don't know how to go for that, if they just by clicking on the Google and searching, oh, this I have the five ratings, we should go there. It's not like that. Try to, if it is diagnosed, then try to go a comprehensive cancer center wherever you want. And if you have any doubt, try to approach any of the clinical oncologist or any of the oncologists to find it out, to rule it out as early as possible. Because if we diagnose early, then treatment is very good, always. And then this is the word united. Uniqueness. Uniqueness means personalized treatment. It is about if patient is diagnosed in this era, so accordingly we can personalize the treatment. So every patient has some uniqueness in their disease, and accordingly we can personalize. Now genetics is coming completely in full picture. Now in coming era, completely there will be a genetic profile of all the patients about their DNAs and RNAs, how they are working on that, and we'll able to hit more properly before about the treatment. It's not about कि okay ये है तो उसको ये वाला ही कीमो लगा दो, ये वाला है तो वो लगा दो. It's not about the general things. Now we are going to customize the treatment, tailor the treatment about according to the genetic profile of the patient. So we are working towards that. We are walking fast now towards that thing, and we're definitely going to achieve it in coming this era or coming this decade about how to completely personalize.
That's great, sir. I think we have listed most of the myths and we have debunked most of the myths.
So it's not about the most of the things we need. Like we can talk R and R about all that things. It's just society should get aware of the right approach. The most important thing is of right approach. So for to be towards that side, they always have to be in a right hand, and right hands are where the complete under one roof all the doctors are there. Radiation oncologists, medical oncologists, surgical oncologists, and other all supporting pillars should be there in under one roof. There they will definitely get a right treatment. It's not about the hospital, it's about a comprehensive cancer center. Wherever they go, they should go in that place. Then definitely the things will be in right order. Because everywhere the oncologists will go for a tumor board also, and we decide their treatment. That is behind the curtains. We do all that exercise, and ultimately we explain the patient this is the best for you, and accordingly.
That's quite extensive of an explanation to what in-depth the doctor does before they share the treatment with you, and I'm sure with the upcoming recent advances we will have much better treatment options and diagnostic options available. Thank you so much, sir.
Thank you, ma'am, so much for inviting me for this crisp about myths and facts for the cancer and for the awareness. Thank you so much.
Thank you.